Uterine fibroids, benign tumors affecting women's health. Uterine fibroids are common benign tumors of the uterus affecting many women. While most remain asymptomatic, some cause significant bleeding, pain, and reproductive challenges requiring targeted management. Understanding uterine fibroids. Uterine fibroids represent one of the most prevalent benign neoplastic conditions affecting women of reproductive age. These growths originate from the smooth muscle tissue of the uterine wall and are characterized by their non-malignant nature. Although fibroids can range dramatically in size, from microscopic lesions to large masses occupying significant pelvic space, the majority of women with these tumors experience no symptoms whatsoever. The terminology surrounding this condition can be confusing, as fibroids are known by several medical names including leiomyomas, fibromyomas, or myomas. Understanding the fundamental nature of these growths is essential for patients and healthcare providers to make informed decisions regarding surveillance and treatment approaches. Epidemiology and risk factors. The true prevalence of uterine fibroids likely exceeds estimates based on clinical diagnosis alone, as many women remain unaware they have these growths. Studies suggest that fibroids become increasingly common as women age, with prevalence rates rising significantly during the reproductive years and continuing into the perimenopausal period. Certain populations appear to experience higher incidence rates compared to others, though fibroids can develop in women across all ethnic and socioeconomic backgrounds. Multiple fibroids within the same uterus are considerably more common than solitary tumors, with many patients presenting with numerous lesions of varying sizes distributed throughout the myometrium. Clinical manifestations and symptoms. The symptomatology of uterine fibroids depends largely on the size, number, and location of the tumors within the uterus. Women who do experience symptoms often report menstrual abnormalities that significantly impact their quality of life. The severity of clinical presentation can range from mild inconvenience to debilitating conditions requiring intervention. Location within the uterine cavity, within the myometrial layer, or extending outward from the uterine surface influences which organs become compressed and what symptoms manifest. Some women may remain asymptomatic for years, only discovering fibroids incidentally during imaging for unrelated concerns. Key points: heavy menstrual bleeding, menorrhagia, representing the most common symptomatic complaint, often leading to anemia with prolonged exposure. Painful menstruation, dysmenorrhea, that may occur independently of or alongside heavy bleeding patterns. Pelvic pain and pressure sensations, particularly in cases of large or multiple fibroids. Urinary symptoms including increased frequency and urgency when fibroids compress the bladder. Impact on fertility and pregnancy. While the majority of women with uterine fibroids successfully conceive and carry pregnancies to term, certain fibroid characteristics can potentially interfere with reproductive function. The relationship between fibroids and infertility remains complex, with mechanisms varying depending on tumor location and size. Fibroids that distort the uterine cavity or obstruct the fallopian tubes may mechanically impede conception, while those within the myometrium might alter the endometrial environment necessary for implantation. Some evidence suggests that even asymptomatic fibroids in specific locations could subtly affect fertility rates. Additionally, pregnancies complicated by fibroids require closer monitoring, as the combination may increase risks of certain obstetric complications. Diagnostic evaluation. Diagnosis of uterine fibroids typically begins with clinical assessment based on patient history and physical examination findings. A thorough menstrual history can reveal patterns suggestive of fibroid-related bleeding abnormalities. During pelvic examination, an enlarged and irregularly shaped uterus may be palpable, particularly when multiple or large fibroids are present. However, physical examination alone cannot reliably detect all fibroids or determine their exact characteristics. Key points: transvaginal ultrasound allowing detailed visualization of the endometrium and identification of submucosal fibroids. Transabdominal ultrasound providing global assessment of uterine size and fibroid location within the uterine wall. Magnetic resonance imaging offering superior soft tissue characterization and precise mapping of multiple fibroids. Hysterosonography, saline infusion sonography, improving visualization of fibroids protruding into the uterine cavity. Conservative management strategies. For asymptomatic women or those with minimal symptoms, conservative management focusing on surveillance represents an appropriate initial approach. Many fibroids grow slowly or remain stable in size, particularly in women approaching menopause when hormonal changes may naturally arrest growth. Regular imaging at specified intervals allows detection of any rapid enlargement or concerning changes. This expectant management strategy avoids unnecessary intervention while maintaining awareness of the condition's progression. Medical treatment options. Several pharmaceutical approaches can reduce fibroid-related symptoms, particularly heavy menstrual bleeding. These medications work through various mechanisms to decrease bleeding volume and alleviate associated symptoms. Non-steroidal anti-inflammatory drugs may reduce menstrual pain and can moderately decrease bleeding volume when used specifically during menstruation. Hormonal contraceptives normalize menstrual cycles and often substantially reduce bleeding in women with fibroids. Progestin-based therapies, including oral progestins or levonorgestrel-releasing intrauterine devices, provide effective bleeding control for many patients. Gonadotropin-releasing hormone agonists suppress ovarian estrogen production, causing fibroid shrinkage and symptom resolution. The long-term use requires careful consideration of side effects and bone health implications. Surgical and minimally invasive interventions. When conservative and medical approaches prove insufficient, several surgical options exist for fibroid management. Hysterectomy, the surgical removal of the entire uterus, remains the definitive treatment, eliminating any possibility of fibroid recurrence. However, this approach is irreversible and eliminates fertility potential, making it unsuitable for women desiring future pregnancies. Myomectomy, the surgical removal of fibroids while preserving the uterus, offers an alternative for symptom relief while maintaining reproductive capacity. This procedure can be performed through various approaches depending on fibroid location and characteristics. Minimally invasive techniques including hysteroscopic resection for submucosal fibroids, laparoscopic myomectomy for accessible tumors, and robotic-assisted approaches have expanded treatment options with reduced recovery times compared to traditional open surgery. Emerging minimally invasive technologies. Contemporary medicine has introduced several image-guided and energy-based approaches for fibroid treatment that avoid traditional surgery. Uterine artery embolization involves selective catheterization of blood vessels supplying fibroids, reducing their blood flow and promoting tumor degeneration. Magnetic resonance-guided focused ultrasound applies concentrated ultrasonic energy to ablate fibroid tissue under real-time imaging guidance. These approaches appeal to patients seeking less invasive alternatives to surgery while maintaining uterine integrity. The expanding array of treatment modalities allows individualization based on patient preferences, fibroid characteristics, and reproductive goals. Lifestyle considerations and supportive care. Supportive measures complement medical and surgical treatments in managing fibroid-related symptoms. Iron supplementation becomes particularly important for women experiencing chronic heavy menstrual bleeding to prevent or correct anemia. Dietary modifications, including adequate iron-rich foods, support healthy hemoglobin levels. Pain management strategies such as heat therapy and gentle exercise may provide symptom relief without medication. Psychological support addresses the emotional impact of chronic symptoms and the stress associated with managing a chronic gynecological condition. Educational resources empower patients with knowledge about their condition, treatment options, and expected outcomes, facilitating informed decision-making. Monitoring and follow-up recommendations. Appropriate follow-up strategies depend on the chosen management approach and individual patient circumstances. Women under conservative management require periodic imaging to document fibroid stability and detect concerning changes. Those receiving medical therapy should undergo reassessment to evaluate treatment efficacy and adjust regimens as needed. Following surgical interventions, surveillance imaging helps identify recurrence patterns and informs long-term management. Close coordination between gynecologists and patients ensures optimal outcomes and addresses emerging concerns promptly. The goal of ongoing management is maintaining symptom control while minimizing treatment-related morbidity and preserving quality of life. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.